Having a conversation earlier that it wouldn't necessarily affect the vaccines, like vaccines can be helpful against many different strains, but it would hurt herd immunity, and that you have to have a higher percentage of the population than immune from the disease in order to reach that milestone level because the new strain spreads so fast. Have you heard chatter on that?
I think a lot of these conversations about herd immunity are probably, I think far more complex than we're able to have in a really quick way. Yes, that certainly does, I think, make quite a bit of sense. Right now, though, obviously the priority for public health authorities is getting people vaccinated just to start with, because we're certainly a very, very far way off from herd immunity. No matter how you slice it. But yeah, I believe typically the more infectious the disease is, the higher threshold you have on some kind of herd immunity in order to have a protective effect throughout society.
And of course, the more you can vaccinate, the better. So that leads us to AstraZeneca. It seems like the UK is going to approve that vaccine sometime this week. Can you give us the latest on that and when we can expect other countries to do the same?
That's certainly what it looks like. We've heard some promises out of the CEO of AstraZeneca in another media report that they have great data that they're waiting to show. As far as I know, we haven't seen it publicly. We don't know exactly when the UK might act. It could be, anytime this week, obviously. I think the real question with AstraZeneca, certainly we just had some, issues around the quality of the presentation of their data, is where's the evidence? You want to see the backing for anything that's going to be approved, and you want to be able to parse through it and really know what you're dealing with. I think that one thing we do know is that we don't have an emergency authorization application into the U.S. FDA from them, and that typically, while it can move fast, I think that is something we have not seen, and we would probably need to see first. So I wouldn't be surprised to see other countries lagging the UK potentially significantly until we see more information from the company.
What I find interesting is that AstraZeneca over in Stockholm was barely up today. Novavax is down 5% here in the U.S. Are we losing the market joyfulness as it relates to vaccine? Has that story been played out already, Drew?
Yeah, I think one of the things that people may be beginning to realize with this is that what you really, the goal from a public health standpoint has been to turn these vaccines as quickly as possible into essentially cheap commodity products that are functionally interchangeable. From a public health standpoint, from a public policy standpoint, what you want is a whole bunch of highly effective, very easy to manufacture, inexpensive vaccines that all work just as well as each other, and hopefully that efficacy is very, very high. In the pharmaceutical world, that's not necessarily conducive to an ultra-high stock price or a big bump when you basically have a whole bunch of competitors making more or less the exact same thing as you with very little differentiation and are widely available. From a public health standpoint and ending the pandemic standpoint, it's great. It's exactly what you want. But, as an investor, it might be the sort of thing that you begin to look at and say, oh, this isn't, the best thing in the world. The flip side of that, obviously, is that you get to reopen, the global economy, which has been decimated by this thing. So there's certainly a pretty big silver lining.